Right now, the state of Florida is suing the FDA over a proposal to get cheaper prescription drugs to you. This is 10 Tampa Bay. I'm Josh Sidorowicz.
And I'm Courtney Robinson. This morning, Governor Ron DeSantis was in Lakeland. He was here in our area to announce and answer questions about the state's lawsuit against the U.S. Food and Drug Administration. As 10 Tampa Bay's Liz Crawford explains, Governor DeSantis and President Biden both agree on the program, but they differ on the when and how to make it happen.
Speaking at a pharmaceutical distribution center in Lakeland, Florida Wednesday, Governor DeSantis explained why the Sunshine State is suing the FDA.
It's our view that we've waited long enough.
DeSantis said back in 2020, the state applied for permission from the feds to purchase certain prescription drugs directly from Canada.
These are the same drugs that you purchase here. They're just like 80% cheaper or 75% cheaper.
It's a program President Biden supports, signing an executive order last year directing the FDA to work with states on importing drugs at lower costs.
They have unlawfully withheld and unreasonably delayed approval of Florida's program.
The FDA says it's working on a pathway to purchase drugs at lower costs from Canada without imposing additional risk to public health and safety. Some political analysts question if the lawsuit is a way to gain political points ahead of the election.
Democrats have always wanted, to fight for seniors in particular for prescription drugs and other health care benefits to seniors, especially in a populous state like Florida. And I think that's one of the things we'll actually see in this gubernatorial race.
So why are we in this situation to begin with? Our politicians are fighting and now going to court over buying medicine from Canada. A sharper insight for you. First of all, Americans spend more on prescription drugs than anyone else in the world. Right now, we spend about $1,300 per person every year on pharmaceuticals. Germany comes in second, along with Japan. They spend about $950 per person. So why do we spend so much? Well, we're charged more. The same drug here costs less in Europe. And that's because, unlike other countries, the U.S. government doesn't directly regulate medicine prices. The drug companies set the price, so they jack it up when they can. But there is another side to all of this. Pharmaceutical companies argue they need the big profits for research and development of new drugs and life-saving treatments. Liz Crawford, 10 Tampa Bay.